Mr. Lethole was not offered food at Tembisa Hospital for 100 hours and 54 minutes. I don't know what's happening. Anybody who's an investigator or a detective will realize that Mr. Lethole's journey started on the 23rd, which is accurate, but it ended up on the 1st when his body was taken out of the hospital, not on the 27th when he was intubated. So between the 27th and the time of his death, Mr. Lethole was to be fed. But the hospital withholds that information from the public. It's as if the journey ended on the 27th, but they don't want to talk about the 27th, 28th, and 29th when he was alive. They should have demonstrated that they didn't give him food like they've shown there, that between the time when he was in Ward 23 and intubated, he received food. But after that, he was still in Ward 23 until he died. He was supposed to receive food. He never received food. So the hospital is smart enough to withhold information. One of the senior nursing staff at the hospital, when asked by the investigator, have you provided Mr. Lethole with food? She claimed that she gave Mr. Lethole breakfast at 9:30 on the 23rd. Now the records, we all agree, including the hospital, that at 9:30, Mr. Lethole was leaving Kempton Park Clinic. He wasn't at Tembisa. But some nurse at that hospital claimed that he had already given him breakfast. There were many areas that I identified that constituted medical negligence. Okay. But Mr. Lethole, as I indicated, when he arrived on the 23rd, he had systemic, severe, overwhelming SARS-CoV-2 infection. And remember that he arrived on the 23rd. It wasn't until the 26th that he was seen by a certified medical doctor at a tertiary hospital. I didn't bring that as part of my findings. So you arrive at the hospital on the 23rd at about midday. You don't see a doctor until the 26th at about 9 o'clock, and you have severe COVID infection. So by that time, because his kidney functions had not been attended to, in fact, they didn't even know that, the doctors that were looking after him. They didn't assess his chest x-rays. They have never seen them until we were interviewing them. So let's take it that he had overwhelming COVID infection that was compounded by, I think, these episodes of medical negligence. I would not say that he died of medical negligence. That would be inappropriate. In fact, in my own findings, I said that had they attended to this issue, and maybe I just wrote the English slightly differently, I said his outcome might have been different. Now, Tembisa Hospital is classified as a tertiary level hospital. I believe it should not, it doesn't fit that level. It should be reviewed. I also don't think that the hospital was ready for the COVID hospital, despite the fact that when Mr. Lethole was admitted, we were already 3 months into the pandemic, and there had already been several warnings about what to do in this pandemic. There were, I believe, systemic faults in Tembisa. I don't think anybody doubts that, and they are recorded in our findings. However, the management of the establishment had not done their job, and I think it comes through everywhere in the report. More importantly, I think individual healthcare professionals involved in providing care also failed to discharge their responsibility, and their conduct could not be explained by the broader systemic defaults. I want to emphasize that. We know that the system is constrained, as we use the term in ESCOM. We always talk about a constrained system. The health system was also constrained, I think, in relation to this pandemic. But that does not absolve individual health professionals to do reckless things.